my name is Danny Smith, and today I'll be presenting on plantar fasciitis for my Advanced Care and Prevention of Athletic Injuries class. Today I'll be talking about plantar fasciitis and what it is, the anatomy of it, the mechanisms of injury, signs and symptoms, evaluation of the injury, treatment of the injury, rehabilitation of the injury, return to play criteria, is taping necessary, and prevention of plantar fasciitis. Plantar fasciitis is a catch-all term that is commonly used to describe the pain of the plantar aspect of the proximal arch of the heel. The plantar fascia is aponeurous that runs the length of the sole of the foot and is a broad, dense band of connective tissue. It is attached to the proximally and the medial surface of the calcaneus that fans out distally, attaching to the metatarsophalangeal articulations and merges into the capsular ligaments. The plantar aponeurosis assists in maintaining the stability of the foot and secures or braces the longitudinal arch. According to Lisa Chen, MS, ATC, and Jay Hurdle, PhD, ATC Clinical Sports Med, 2010, the foot and ankle can be divided into the rear foot, midfoot, and forefoot. The rear foot consists of 4 bones, the distal aspect of the tibia and fibula, the calcaneus, the heel bone, and the talus. The midfoot consists of 5 bones, the cuboid, navicular, and the 3 cuneiforms. The forefoot consists of 19 bones, 5 metatarsal bones, 14 phalanges. The plantar fascia originates from the medial calcaneal tuberosity dividing to the medial central and lateral band that attaches to the superior surface of the abductor hallucis. Flexor digitiform brevis and abductor digitiform minimi musculature, respectively. The fascia splits into 5 split that cross the metaphalangeal joints and inserts the phalanges of digits 1 through 5, 1, 8, 19, and 20. According to Cutts S, OBN, Pasupala C, Chan W, 2012, Plantar Fasciitis, Annals of the Royal College Surgeon of England, it suggests that plantar fasciitis represents a form of tennis elbow at the heel, with the condition being caused by repetitive microtrauma at the point of insertion. Inflammation triggered by microtrauma might also explain why the condition sometimes responds to local steroid injection. At night, the foot usually falls in plantar flex position, and when the patient rises from bed in the morning, the foot moves into dorsiflexion during walking. The plantar fascia slightly contracts in bed, and the initial stretching association with the early morning walking is probably responsible for initiation pain. The classic sign of plantar fasciitis is that the worst pain occurs with the first few steps in the morning, but not every patient will have this symptom. Patients often notice pain at the beginning of activity that lessens or resolves as they warm up. The pain may also occur with prolonged standing and is sometimes accompanied by stiffness. In more severe cases, the pain will worsen toward the end of the day. According to the American Physical Therapy Association, the physical therapist diagnosis is based on your health and activity history and a clinical evaluation. Your therapist will also take medical history to make sure that you do not have any other possible conditions that may cause the pain. Sharing information about your relationship of your symptoms to your work and recreation and reporting your lifestyle changes will help the physical therapist diagnose your condition and tailor a treatment program specific to your needs. To diagnose plantar fasciitis, your therapist may conduct the following physical tests to see if symptoms occur: massaging or pressing the heel area for palpation, gently stretching the ankle to the top of the foot toward the leg, dorsiflexion, and gently pressing the toes toward the ankle. Some of the acute treatments for plantar fasciitis include taking non-steroidal anti-inflammatory drugs. If the pain worsens, possible steroid injections may be considered. Rice, rest, ice, and elevation. Stretching and strengthening, like Gabby is showing right here. You will stretch against a slant board or a wall. Or getting better arch support for shoes or orthotics based on the person's shoes. Or putting their foot on the wall to stretch the plantar fascia. Methods of prevention for plantar fasciitis. Some of the methods include utilizing strength training by strengthening your arch muscles, and you could do this by grabbing a towel with your toes and scrunching it up. Sometimes you can also you'll have marbles on the floor and you'll grab the marbles and put them in the bucket with your toes. Using bands are also a great way to stretch the plantar fascia when pain is noticeable. Rehab guidelines. Clinicians should consider limited ankle dorsiflexion range of motion and a high body mass index in non-athletic populations as factors predisposing patients to the development of heel pain and plantar fasciitis.
According to J. Ortho Sports Physical Therapy 2006, calcaneal taping was shown to be a more effective tool for the relief of plantar heel pain than stretching, sham taping, or no treatment at all.
After taping the calcaneus, you'll make sure the athlete can move their foot through a full range of motion, and you also check their pulse, make sure they can still have feeling in their feet after you're done taping. Return to play criteria with athletes with plantar fasciitis. They must have a full range of motion, no pain during play. According to the American Medical Society for Sports Medicine, treatment and return to play after plantar fasciitis can be lengthy. Additionally, symptoms can return if training is resumed too early or quickly. The physician may recommend cross-training with non-impact activities like squats until the morning stiffness and pain is minimal. It is important not to train through pain, and some other non-impact activities can include leg press as well. Ways to prevent plantar fasciitis in athletes who are jumping athletes include proper landing techniques with a coach or athletic trainer. Focus on landing with the mid-foot strike rather than the heel. This keeps the plantar tendon relaxed and reduces the impact of the heels.
Thank you for watching this video, and I hope I taught you about plantar fasciitis. Not only what it is, but the anatomy, symptoms, mechanism of injury, evaluation, treatment, rehab, return to play, and prevention of the injury.